All right, everyone, we have half an hour, so I'm going to kick it off. I want to thank you for joining us this afternoon. It's great to see so many members of our literary circle group, our Toronto Public Library Foundation Board, our esteemed Governor's Council, donors, and friends of the library. To our guests who are new to these events and the Toronto Public Library, we're thrilled you're with us today. For those who don't know me, I'm Jennifer Jones, the president of the Toronto Public Library Foundation. I'm stepping in for Sarah Fulford, who sends her regrets. Those who have joined many of our events know how fantastic a host Sarah is, so you'll have to bear with me as I try to fill her very big shoes. First, I'd also like to begin by gratefully acknowledging the City of Toronto, including all Toronto Public Library branches, all 100 of them, are situated on the Indigenous land and Dish with One Spoon territory. This is the traditional territory of the Haudenosaunee Confederacy, the Wendat, and the Mississaugas of the Credit First Nations. Toronto Public Library gratefully acknowledges these Indigenous nations for their guardianship of this land. I'm excited to kick off today's presentation about two important TPL initiatives that you may not know much about: community librarians and an innovative social services team pilot. First, you'll hear about the community librarians who are out in the community, making a difference beyond the traditional walls of a library branch. They connect with vulnerable populations right at their point of need. Community librarians provide vital connections and services to patrons at a variety of social service agencies across the city, such as local shelters, refugee, and incarceration centers. Joining us today is Vickery Bowles, Toronto Public Library's fearless city librarian, and Pam Ryan, TPL's Director of Service Development and Innovation. Together, they make a powerhouse team, and I'm excited that over the next 10 to 15 minutes, we're all going to learn more about the role of community librarians and plans for an innovative pilot with an in-branch social service team. There'll be time at the end to answer your questions, but please feel free to include them in the chat along the way. And because we're a relatively small group, at the end, I encourage you to take yourself off mute and jump right in if you'd like to ask the question yourself. So like all of you, I look forward to hearing more, and let's get started. Vickery, over to you.
Thank you so much, Jennifer. And welcome everyone. It's so lovely to be here today with so many people participating. Pam is our Director of Service Development and Innovation, as Jennifer mentioned, and an important part of the work that Pam does is developing new services in response to the community's needs. And a really important part of 21st century public library service is this new stream, I call it a new stream of service. So we have our in-branch services. We have online services, which through the pandemic have accelerated and become much more robust and extensive than ever before. And those are two really, really important streams of the way we deliver services. But increasingly, we're also delivering services out in the community. As Jennifer said, meeting people and reaching people where they are at their point of need. And so that's what Pam is going to talk a lot about today, is our community librarian program, as well as the social service team pilot project that we have been developing. And this is really an important, as I said, part of 21st century public library service, and certainly important in a city like Toronto with so much complexity in terms of the people we serve and the communities that comprise the city. So with that, I will turn it over to Pam to take us through the presentation.
Thanks so much, Vickery, and hello everyone, and thank you for joining us today. We're really thrilled to be able to share a couple of ways that TPL has designed services to better serve the vulnerable people in our city, community librarians and social service teams. I'll start with community librarians. Since September 2016, TPL has had librarians working outside of library branches and inside select community-based organizations to work closely with clients and staff of those organizations. We refer to these people as community librarians, and other public libraries also are starting to offer these types of services in models that make sense for their communities. But the overall community librarianship is all about delivering relevant service at the customer's point of need. And to date, all of TPL's customer librarian placements have been made possible through the generous support of the Toronto Public Library Foundation donors and other temporary or grant funding. The Community Librarian Program remains a key fundraising priority for TPL, with our top priorities for placements being in agencies serving newcomers and refugees, in shelters, in agencies serving incarcerated or recently released individuals, and on agencies focused on serving Black populations. So here's some photos of some of our community librarians and some of their placements. Community librarianship aligns really closely with TPL's strategic priorities, including our focus on equity and our commitment to breaking down barriers to access and supporting inclusion. It focuses on serving equity-deserving groups and vulnerable populations in the community and outside our branches. It helps address the digital divide by providing access on-site to technology and digital literacy training supports. And it creates opportunities for learning and skill development, including job search, job readiness training. And it builds connections between agency clients and the wide range of services available in their neighborhood, which contributes to their resilience and their overall well-being and success over the longer term. And it also builds strong relationships between TPL and all of these community agencies, setting a further foundation for us to build partnership and collaborations on to meet community needs together. So our community librarians have been placed in a wide variety of settings, always with a focus on reaching out to vulnerable populations. And this is a list of some of our partners and a sample of the agencies that have hosted a community librarian. You can see there's the Costi Family Immigrant Reception Center, which serves refugees, the FCJ Refugee Center, Jane Finch Community Center, Rexdale Women's Health, Toronto Employment and Social Services, a very important partner, and Toronto Shelter Support and Housing Locations in different shelters, as well as the Toronto East and South Detention Centers. So what do community librarians do? Overall, they remove barriers that cause individuals not to be able to access library services. For example, sometimes this is as simple as waiving existing library fines, as fines are a barrier for individuals and families who cannot afford to pay for them, and they keep people away from the libraries altogether. We have many examples of individuals who interacted with community librarians who felt that they were not welcome in the library because of a very small outstanding fine. So community librarians are able to reconnect, help deal with those fines, and welcome them back to the library. Community librarians also provide access to library services to people who may never have had used a library before, such as many newcomers not having the same culture as a public library in Canada. And as well, provide customized library programs specific to each individual community's needs. So for example, community librarianship doesn't look the same in every community. In this particular example with shelters, where community librarians deliver on-site programs, and actually through the pandemic, we're delivering remote programs as well, while we had restricted access to entering buildings. But they provide card registration and renewal. They help residents find and navigate information resources about housing, employment listings, navigating government documents and government benefits, providing on-site computer training courses, loaning Wi-Fi hotspots, providing internet connectivity kits, distributing free Presto cards because of via our relationship with the TTC. And then programs are customized to the client's needs and interests. So for example, you can see a chart here from the Fort York shelter where there's courses such as resume writing and interview skills workshops, but there's also book clubs and other leisure activities that you'd find in any branch. TPL also regularly provides book donations to shelters to have materials on site. So why do we do this? Because we know that there can be many barriers to making the step to come to a library, from transportation costs, not feeling welcomed in the library, not knowing how a library can help, and then the simple fact of how complex the lives of vulnerable people are just to meet basic needs. But we also do it because we know it has a profound impact on people's lives when we come to them. And then, like the community librarian model is to serve vulnerable communities in their point of need, our new social service team model will do just that in our branches, where we serve vulnerable people every day. This would be Canada's first library-based social service team, which would include a social worker and a community health nurse. Together, this team would support individuals who are the most vulnerable, with a focus on people experiencing homelessness, who face multiple barriers in accessing the mental and physical health resources and social service supports required to improve their lives. We already know that we're a safe and welcoming space for vulnerable populations, and we are uniquely situated to help serve these needs. For TPL, rebuilding our city post-pandemic will mean providing all of our citizens with the tools they need to build their resiliency and to build back their lives. This multidisciplinary team would begin working within our branches most in need of these services, focusing initially on branches in the downtown core. And we're hoping the foundation can find support for a pilot of this first in Canadian libraries. So what will the social service team do? They will provide frontline support services such as intake and referral services and provide health-related information. They'll help customers navigate the social service network, government services, benefits, employment or housing applications. They can provide health promotion workshops such as healthy eating and harm reduction, and they can provide simple healthcare services on site like blood pressure checks. And while a dedicated social service team would be a new idea, TPL has already taken the first steps in integrating social services into our branches, so we know it works. But we also know that we need this model to help accelerate this success. We know we can do this because we already have had success with having a full-time social worker on staff, but they support our staff in their work with vulnerable populations, so an internal focus. But we've also had social workers integrated into different branches, mostly working with youth on a temporary basis. We've also partnered with Toronto Public Health to have public health nurses visit select downtown branches, and they were providing on-site mental health services, making referrals to community supports, as well as providing support and advice to our staff. And we have an ongoing relationship with the University of Toronto to integrate Master of Social Work students to help support staff development in our community engagement initiatives, which is run by TPL's social worker. So that's my overview for this afternoon, and we're really looking forward to being able to answer any questions you might have. I will turn it over to the crowd, please. Like Jennifer said, feel free to just speak up.
Yep. I'll give it a second because I can't see everyone online. So if you are going to speak, please feel free to unmute yourself and jump in. I'm also looking at the chat in case anyone wants to include questions there. I do have a few questions ready to go, but I want to make sure that our guests have a chance to. Okay. So Pam, why don't I jump in? I didn't fully appreciate that the community librarian program has been running since 2016. And I'm sure a lot of people weren't aware of this amazing program out in the city. What's the reason that you and Vickery wanted to talk to our supporters today about it? And has the pandemic had any impact on the need for the library to have even more perhaps community librarians out there doing this good work?
For sure. I mean, I guess I'll address your second question first around the pandemic. I mean, I think what we found is that while we've had this model since 2016, we had to develop a new model because of the pandemic, and found that it was just as impactful and as important to be able to provide remote supports. The community librarian working with shelters was able to have Zoom calls with individuals, be able to support whatever their needs were in terms of trying to find housing or other resources. And overall, we just know that the need for on-site integrated community librarian support is just increased because of the pandemic, because of where people have been, for the last year in terms of not mostly shut in, not engaging with others, or just needing to get back into the job market. So those supports on site, either to help them on site or to help bring them back to the library to show them the wider range of resources we have available, it will be just such an important connection to help us recover.
That's really helpful context. How many community librarians are you hoping to have in the next, let's say, year or two to start to roll out?
Well, honestly, it is sort of an unlimited need at present. I mean, I think at most we've had 6 working at a time. And we have established relationships with many of the organizations that I referred to, and they would be ready to pick it right back up as soon as we had somebody to offer. So I would love to have half a dozen ongoing to be able to put out into the community to serve our targeted agencies of agencies serving refugees and recently released or incarcerated individuals, ready to go as soon as we're able to get back into organizations.
So if you're looking for half a dozen, how many do you currently have? Help me understand the significance of that number 6.
Well, the one that we had, we only had one for the last little while. I think we had 2 up until the start of the pandemic, or about mid-pandemic. And then the funding ran out for one position, and the one that we had working in shelters just ended that contract with the ending of that funding last month. So we currently are, for the first time since 2016, in a position where we have no community librarians.
Got it. So there's a real urgent need to address this. Fantastic. Okay, that's really helpful to understand. Thank you. I'm also looking at the chat questions, and we have one here from our fantastic Wendy Cecil. Is the community program linked to inner city health program at St. Michael's Hospital?
The social service team?
Perhaps. Wendy, do you want to jump in and round
Sure.
out your question at all?
Thanks, Jennifer. Pam, I was just wondering, because the inner city health program at St. Michael's Hospital is quite wide ranging. And in listening to your presentation, I thought, gee, this would be a symbiotic relationship. So I was just curious if there was any relationship at all with St. Mike's.
There isn't about this particular program. I mean, we certainly do have a number of connections to St. Mike's, mostly in youth programs or programs for children. But we are definitely considering that the way that we would work with a community health nurse and with a social worker is with an external agency, that we would be an extension of their existing services. And we have a number of partners that we could draw on were we ready, positioned with funding to recruit and get people in place.
Yeah, because that program was relatively new a number of years ago. Pat Ocampo is head of it, and she's still there. It might be worth exploring.
Thank you.
You're welcome. If I can help, let me know.
Thanks so much.
Thanks, Wendy. And Wendy, you and Nancy Logan must be on the same page, because Nancy has a question here. It says, how does the social service team program initiative interact with other community social agencies?
There you go.
There you go, right?
Right.
So Pam or Vickery, are you able to answer that beyond St. Mike's?
I thought you were just being supportive. I mean, like I said, we have relationships with Toronto Public Health and with the Public Health Nursing Program, and with other community agencies, Streets to Homes, and other outreach organizations. It is the sort of early stage of, we need to know that we have the money to be able to proceed to start with the recruitment and just build on the relationships that we already have with agencies.
Got it. So once you received the funding, how quickly would you be able to get up and running? Would this be a 2022 initiative? I'm curious, especially in light of where the library is, in reopening over time.
Well, for the social service team who would be working in libraries, of course, we need to be able to welcome people back into the libraries. That's looking quite positive. But I would expect that we would be able to have the program up and running in fall of 2021, this fall, to get folks, supported as they start to return to us.
That's amazing. All right. Janet has a question that is a little bit of a pause on these very specific programs, and a really interesting look at how the librarians in general are trained to deal with the vulnerable community that come through your doors every day. What kind of training do library frontline workers receive to interact with the vulnerable, challenging members of our community, people with mental health issues and so forth?
It's a good question. I mean, we have a very robust internal training program because, of course, we're a large urban public library system with these kinds of concerns across the city. Like I said, we do have a full-time social worker who works solely in support of TPL staff. So bringing that social work discipline and connections to other community agencies for training our library staff. They have a wide range of training for dealing with folks, experiencing homelessness, for folks with mental health challenges, for de-escalating, difficult customer service interactions. So it's already just a core set of what all public service staff at Toronto Public Library receive. And then there's extra special training that community librarians get, mostly by the agencies that they're placed in, that they have their own training supports that they provide to our staff when they start working with them.
Got it. Thank you. I'm scanning the chats for other questions, and I'll pause in case anyone wants to ask their question verbally. I see there's a lot of people in, participating. No? Okay. I'm really curious about the social service team model and how unique that is to libraries. Like why? Yeah, and you explained a little bit, I think, based on what you just said about the training and the individuals that the library serves every day. Why is the library the right place to bring this expertise to your clients? And how unique is this for a library to offer it?
Well, many libraries in North America now have some connection to social workers, and many libraries have some connection to public health and public health programs or services or relationships. And from our experience, having experience with both individually, we just know how powerful it would be if they worked together in a team, that they then can help address, the multi-barriered needs that individuals present with when they're in our branches, and they can work together to help that individual and provide the best of both disciplines, nursing, public health, outreach, and social work together as a team. I see there's a question in the chat asking, can we elaborate on the program's relationship with the Masters of Social Work students? I can. For the last couple of years, it's actually not with the community librarians, it's with our social worker. So we have, I said, a full-time social worker, and she works with the U of T and the students on, they have a kind of co-op placement requirement, and they have come in and worked in different TPL branches as part of that, and helped develop library-specific either training or supports, or working with our staff on bringing the best of their discipline into our practice.
May I ask a question, Jennifer?
Yes, please go ahead.
I'm just wondering if you think that part of the library's success in this particular area is due to the fact that the library is such a non-threatening institution and seen as a place to go for help for any number of things. Is that part of it? And how do you ensure that you protect that that image of the library, that sense of the library, as you get more deeply involved?
I'll just start by answering that question by saying that, and giving you a recent example of what we've experienced. We were recently contacted by a doctor who is leading a team of healthcare providers from Ontario Health, and they're trying to reach Torontonians in neighborhoods where there is a low vaccination rate for seniors. Yeah. And they wanted to hold the vaccination clinics in libraries because it's such a trusted place and such a place where people feel comfortable going to. And so we've held just in the past few weekends 5 different vaccination clinics in a few of our branches in neighborhoods where there has been this low vaccination rate amongst seniors. And they chose libraries specifically because people felt comfortable, people who are hard to reach would feel more comfortable coming to the library to get their vaccine. So I think, Wendy, I think that is a really good example of what you were just talking about, is that people do feel more comfortable coming to the library. It's a trusted place for them to come to.
And it starts when you're a child, when your mother takes you to the library or something, that you always know that is a safe place to go. I know myself, when my children were starting to travel, one of the pieces of advice that I gave them was, if you get into trouble for some reason, or you're really stuck, find a library or go to a university. They were the two, because some countries you don't go to the police officer. So the library, I think it's even an international feeling that it's a safe place. It's a place where you can go for help. So that's wonderful about the vaccinations. I think that's terrific. And it also leads me to wonder if it will help with those who are vaccine resistant, without being a heavy hand, but nonetheless, a gentle hand on the back to encourage them to do it. Thank you, Vickery.
Thank you.
Thanks so much, Wendy, for your always passionate support, and championing the library. It's amazing. Marianne, it looks like you have raised your hand to ask a question. We have a couple minutes left, so you will be the one to get the last question in.
Yes, my question is really, how do you promote the community program in this lockdown times? Because the library is open to pick up reserved books. I mean, vaccination may be at centers, but how, is it mostly virtual now?
Well, the one community librarian we had up until the end of May, she was embedded right in the shelter prior to the pandemic. And then when the pandemic hit, she had to start working remotely. So she already had established relationships with the shelter staff and with many of the residents. So those relationships allowed, it was quite seamless to be able to just transition to, I'm still here, I'm still available. You just have to contact me here, or go and talk to so-and-so staff member to say that you need to talk to me, and they'll figure out how to make the connection. So it really is, this is a very relationship-based service, and that's really the strength of it.
And just one additional, are these community programs available in most branches or just selected branches of TPL?
The community librarians?
Mm-hmm.
The community librarians, actually, they don't work in branches at all. They are embedded into agencies.
Oh, okay. Right.
Yes.
Thank you.
So, yeah.
That's it.
All right. Thank you, Marianne. Glad we squeezed you in. And we are coming to the end, so I'm just going to wrap up now. I want to say a big thank you to Pam and Vickery, who always do such a brilliant job articulating the amazing work of the library in our city. And at the foundation, we are actively seeking funding for the projects that you just heard about. If you're interested in learning more, please contact me, or if you have a contact already at the foundation, any of us can help you with your question. I know the library would like a lot more of these community librarians, as you heard Pam talk about, and to be able to pilot the first social service team would be a really exceptional experience for the library and the foundation. I think what we all heard today is the library's example of, yet again, being innovative and really understanding how to deliver the services exactly at the point of need for its customers, particularly the more vulnerable. And I know a lot of us who work with the library and who support it take great pride in being part of an institution that makes such a difference in our city. So thank you for taking time out of your busy schedules to join us today. If you have any questions at any point, please let us know, and take care, stay healthy, and hopefully enjoy the summer as much as you can.
Thank you so much, everyone. Thank you.